Hello, ladies and gentlemen. My name is Wojciech Furmanek, and I'm the managing director of Sanatorium San. When I broke the neck section of my spine 5 years ago in a bike accident, no one at Sanatorium San was able to help me. But much has changed since then. We have created a team of specialists, as well as a program called individual therapy. It is the topic of this video, which I kindly invite you to watch. We will see the struggles and hear the impressions of 4 patients who have been our guests recently. I hope you enjoy the video. Hello, my name is Marius. I'm a therapist. We will try a session of manual therapy. Please come in. The pains are coming from the neck section, so we will try to locate their source. We will check the arm mobility. Please raise them slowly. Are you feeling any pain in this position? In my neck, a little. Lower your arms slowly. Raise them to the front. Lower them slowly. Loosen up. Are you feeling any pain? Yes, in my shoulder blade. Next, we will try the mobility in the neck section. Our 2-week plan will involve increasing the mobility of the neck section through mobilization, friction massage, function massage, and stretching. I will also start introducing autotherapy, a very important component. All manual therapy techniques are perfectly safe. They are preceded by safety tests. Nothing is done without thorough preparation, so please do not be afraid. Stay calm, relax. Relaxation will definitely help us throughout the therapy. Welcome, Madame. My name is Robert Kott. I will be leading your manual therapy sessions. Please come in. And now, please flex. Hold the tension. 3, 2, 1, and loosen up. And once more, flex. Bend your lower leg towards your buttock. 3, 2, 1, and loosen up. Hello, I'm Agnieszka Kromerczek. I see that you're prepared. Smile. Let go of tension. Try the swimming pool. Hello, my name is Marius. Please come with me. You have some problems with your knee, is that right? The so-called jumper's knee? Since when have you been feeling them? Since mid-October. Have you had any surgery? I haven't. Have you tried manual therapy before? Not yet. Are you feeling pain only in your knee? Not only, in my lateral ligaments as well. Okay, here is the catch. Please lie down on your back. Please actively bend your knee and hip joints. Bring your knee towards your chest. Okay, good. Now, loosen up. Are you feeling any pain now? No. Okay, loosen up. And now? And now? From the right side. Let's check. Okay, thank you. Under my kneecap. We have carried out a preliminary examination of the knee. Hello, Madame. I'd like to invite you to the therapy. have already learned everything from your doctor, so we can start right away. Are you feeling any pain in your calves or thighs? Not now. And how about the spine? Is everything all right? Okay, let's stay in this position. Good morning. I'm Agnieszka Kronacek. Welcome to our therapy sessions. I have read your medical records. Please come with me to the gym. Breathe in. Breathe out. And breathe in one last time. Now, turn towards the mirror. Very nice. High five. Breathe in, back to the starting position. Pull in some air while breathing in. Good. Let's go further. Be careful. We have to suck the stomach in when we breathe out. Bring your loins closer to the mat and slowly raise your hips, one vertebrae after the other. Now lower your body one vertebrae after the other, holding your abdomen. The sacral part goes last. And back to the original position. Good. Now you're going to work your foot. Bend and stretch. Slowly, carefully. Only the foot. Okay, and slowly relax. It's okay now. I've been looking for such places for so long, and all issues cropped up after the season. Down and back up. Great. And now stand with your side facing the mirror. Half a step this way. Stand with your side facing the mirror and repeat. Now the tape is pulling in a different direction. Down and back up. Watch your knee. Don't let it move past the line of your toes. Halt. Hold your position after bending and move back up. And squat. Hold this position and back up. Watch the position of your soles and toes. Keep them glued to the floor. And back up. How is it? How are you feeling? Tired. I could faint if I tried for too long. Place your feet parallel to each other. Okay, and repeat. Great. Now go back up. You should feel the tension for 3 to 4 seconds. You can look at the other mirror to check your posture. From this position, we lead with the right leg. Step on the platform, step down, right leg. The right leg starts the movement and moves down first. Put your hand flat. Hold it straight. Just like that. A bit more to the side. Towards me. Now it's good. Hold the position for as long as you can. Good. Now reverse to the front. And the other side. Switch to the other side. A bit more. That's it. Hello. After 2 weeks of diligently working together, I would like to tell you what changed since we first met. I will shortly tell you how it was before the sessions. Has anything improved? Definitely. I don't feel any pain. At first it was hard. I even had to use crutches. Of course, just walking down the stairs hurt me. The so-called jumper's knee made many movements impossible. I couldn't bend my foot left or right. Even laying down before sleep was painful. Yes, I'm amazed with the exercises. I will continue doing them at home. I'm used to them after these 2 weeks, and it will make it easier to do the ones I need. Good. I wish you luck. How do you feel after the sessions and exercises? Anything changed? Yes, those 2 weeks surely weren't a waste. The exercises helped me a lot, especially the ones from you. It was largely thanks to you, because you prepared the exercises in such a way that I could do them without pain. You adjusted them to my medical conditions. Now I know that I won't hurt myself while doing them at home. And it was surely a good introduction to independent work. The overall atmosphere was very nice, not only thanks to you, but also to the manual therapist, who made me stretch, so I'm much more flexible. The pain is still there, but weaker and less recurring. I certainly feel much better. Did you get any exercises to do at home? From Agnieszka? I got plenty of exercises to do and tons of valuable advice. Sometimes I tried to work out at home. I felt pain and stopped because I was afraid of hurting myself. And now I know that I'm doing them the right way. I won't hurt myself, and I can really enjoy them. I think I'm going to come again in 2 months for new exercises from Agnieszka. Now it's important for you to work on your own. That's the one thing left to do. I saw how weak my mother was. She also had problems with her spine. And I wouldn't want to become like this and end up in a wheelchair someday. Thank you for taking part in our sessions. I hope they brought the desired result, that we have provided you with some expert advice and, most of all, cured the conditions that you have come to us with. I hope that all the suggestions from your trainers will be useful when you train to plan your training cycle, and that you will return to us not as a patient, but as a colleague, to relax. I was born earlier, so it's kind of natural to enjoy your services from time to time, since my regeneration is a bit slower. With your help, this dynamic approach and some calmness at the same time, touching the parts which really required stimulation, anyone can feel better. You always gladly come back to situations which give joy, not only to the mind, but to the body, most of all, because it seems to be the main motivation that makes us come here with our conditions, because we can't handle them on our own. That's why there are people who know more, who know the inner workings of the body, and it works out perfectly. I was so deeply relaxed that all the aching parts started to send out this signal, telling me that they're starting to work. To put it simply, I could feel my leg work. It was somehow blocked from all the burdens, As I said before, I could start feeling my leg thanks to the stimulation. I could safely use it to support myself. It truly made the leg mine, because it hadn't been working correctly before. Changing the conditions made it regenerate, return to its former state, and the body felt that it really is my right leg. During overtraining, everyone should try it out for 4 to 5 weeks. Maybe not all the sessions, but definitely the swimming pool, the salt cave, and most of all, this manual relaxation of the whole body, especially for the moving parts. Legs for runners. Karatekas would need to relax other parts, to loosen them and allow them to regenerate on their own. Get the power to work at the next stage, during the next season. There is nothing like this in Coobjek when it comes to rejuvenating sportsmen. If I saw something like this, I would have certainly used it. It doesn't have to be in Coobjek, but I will surely keep using it because it's wonderful, and you can also customize a bit. Depending on what the doctor suggests. Especially the manual therapy is a wonder in my opinion. I have one last question. How do you rate the sessions in the gym with the personal trainer? As a man or as a participant? As both. The personality you interact with for those 10 days, several hours per day, has to be dominant. I'm not denying it. But the value of expert advice? We are convinced we know it all, but sending the right communication across to the patient who may not know what to do is the right thing. Such individual therapy or sessions in the gym or at the swimming pool are drills for our behavior. We are forced to remember the next action, to act in the right manner. It might be troublesome at first, but eventually becomes routine. It has for me, since even while cycling, I think about how Agnieszka told me to do it, and that's good. When I applied for the therapy, they found out that I had a slight, how was it called? Overpronation of the foot. Yes, it was pulled a bit to the front, to the inside. Now I do not need special shoes. I stand firmly. I can even stand with my legs spread. I know that my 3 pivot points are all right. This alone tells me that my kinetic system is not giving out, because I feel stable, comfortable. If we want to feel firm, we have to firmly stand on our 2 legs. And now I can even stand on 1. After 2 weeks, it gave me increased mobility. After we worked together for 2 weeks, or at least I tried my best, I can now do everyday activities. For example, even sitting. What did you have trouble with? With bending over, I couldn't do it because I felt a pulling sensation. You said that you had problems with putting on tights. Yes, and I had the most trouble with my nails, manicure, putting on tights. I even came up with my own way of doing it, part by part, standing and supporting myself instead of sitting. Could you show us how it is now? I can now pull it up a bit further. Has your mobility increased? Yes, the other leg is a bit harder to move, but I can manage. As I said, the mobility has increased. It will be your turn to stay in shape, and you will have to make sure your posture is correct and keep exercising. I know. We have even discussed my everyday bad habits. For example, sitting at the desk in a wrong way. I was always leaned forward, feet under the chair, like this, bent over and tense. You taught me something to keep my body straight. When something hurts me, I straighten up. So that's something. But I have to keep doing it. Great, now the rest is up to you. One more thing I'm enjoying. A simple movement. I can work on my toenails or feet. And I couldn't do it before. Individual therapy. We invite you.